Welcome back. Time for 8-1 for your health. With the start of the new year, many individuals start to think of their resolutions, and many of those include weight loss goals. Studio 814's Morgan Cozier sat down with a doctor from Geisinger to hear of all the different options for folks who are trying to do just that.
Welcome back to the show. We are so excited to be joined with a Geisinger physician, Dr. Mohammed. Welcome into the show. Can you tell us a little bit about your journey with Geisinger and how you came on board?
Yes, thank you. Geisinger is a very well-known organization and highly regarded in the surgical world and along with our surgical society. So I've always known about the Geisinger health system, and so the job was posted on one of our websites on our surgical society. So that's how I heard about it, and I've always known about really great things about Geisinger, and so I applied for the position.
And talk about what you specifically do.
So I am a minimally invasive general surgeon, board certified, and I specialize in foregut surgery as well as bariatric surgery.
And we were talking, so minimally invasive surgery, that whole department, it plays a big role in when we're talking about some of these treatments that patients can receive. But can you talk about how MIS plays a role in, the treatments?
Well, we treat a vast majority of disease processes. So minimally invasive means basically we perform not open, so laparoscopic via small incisions, and we also do robotic surgery here. So the disease processes that we cover in terms of when we speak about foregut surgery, we're talking about diseases of the esophagus, of the upper GI system, including gastroesophageal reflux disease, achalasia, for example. And then in terms of bariatric surgery, we're talking about treating morbid obesity and metabolic disease processes. And it plays a huge role, especially in terms of patients who are seeking weight loss surgery.
Well, I was going to say, when someone comes to this, decision in their life to go through with a surgery like this, I mean, there must be a reason why, you felt called to choose this as a career, because you are really helping people change their lives.
Yes, absolutely. When I entered medical school, I never really thought about becoming a surgeon, but I saw the importance of what surgery can do for patients' lives, especially with bariatric surgery, the positive impact that it brings into their life. We don't just focus about longevity. We don't just want our patients to live a long life, but we want them to have a long, healthy life, to have with excellent quality. And that is what the role of bariatric surgery has in patients' lives.
Yeah, it's an important thing, because we talk about, when someone is obese, it's not always just, a lifestyle thing. It could be medications. It could come from a varying, degree of reasons. And so just the fact that you have options like this that you can help people, I think goes a really long way. And the fact that Geisinger, I mean, you can get all your treatments right there.
Yeah, absolutely. No, I mean, metabolic disease affects every single organ system, starting from the lungs. People have difficulty being able to breathe. They have pulmonary disease processes like COPD, obstructive sleep apnea, also cardiovascular. These are conditions like diabetes, high blood pressure, high cholesterol. These shorten your life. They cause significant issues, as well as put you at risk for early death, heart attacks, stroke, all kinds of things. And so our patients seek us not because of cosmesis, but they're seeking us because they want to live a better quality of life. They want to feel good. They want to feel better. They want to feel healthy.
Yeah. Dr. Mohammed, what is the best way that a patient would find out if they're a good fit?
So in general, the basic requirements for bariatric surgery is that you have to have a BMI of over 40, or you have to have a BMI 35, above 35 with a medical comorbidity. The best way to determine, of course, the candidacy and whether you qualify for the surgery, it's a little bit more nuanced and complex than that. So the best way to do this is to seek out your PCP, or you can also go to our website, geisinger.org, and obtain a consultation with our weight management, nutrition and weight management clinic. We have a very comprehensive, excellent team of obesity medicine physicians and dietitians who are comprised of our bariatric program, and they help patients along the way and help them prepare, identify and determine if they are a good candidate for weight loss surgery, and then they help them along the pathway and work closely with us to provide comprehensive multidisciplinary service.
And what is the timeline typically, from the initial consultation of the appointment up until, say, you would get a surgery?
Yeah, so the timeline, it varies for every patient. Again, the process requires a enrollment in our bariatric program where you meet with bariatric medicine physicians as well as dietitians. Our team also comprises of psychologic evaluation, and some of these depends on patients' insurance requirements as well, because they require a certain number of visits, for example. And then at the end of the day, the most important is the patient themselves, whether they feel mentally and physically prepared for surgery. So for every patient, it varies. In general, for what I've seen from my patients, it can vary from a few weeks to months.
Okay. Any other tips or tidbits of information that people should know about?
Well, in terms of our service is not just bariatric medicine, of course. Like as I mentioned, if we treat all kinds of not just general surgery, but treatment in the upper GI system. Hiatal hernias, for example, are very common in this region, as I've seen. I know I'm new to this area, but I know from what I've heard from my partners, it's quite common, and that also poses significant risks to patients' lives. Could become an emergency. So I think it's what's important is that seek us out. Go to your PCP, ask for a referral, or if you just want to talk, you have something you're interested in bariatric surgery, we're happy to speak, and we do virtual visits as well as inpatient service. So we're here to take care of your needs and help you live a long, healthy life.
Yes. Dr. Mohammed, thank you so much for your time.
I appreciate it. Thank you very much. Thank you for this opportunity.
We'll be right back after a quick commercial break.